Jelen in quarantine, she's saying, or he's saying, could you discuss different theories behind what is happening to CV19 long haulers? Dysautonomia, MCAS, vasculitis, viral persistence. Also, can the pathology of bradykinin theory in CV19 explain the GIT symptoms? Have not seen reference to that. The GIT continues to be debilitating issues of many patients. So very good questions and simple answers. So let's look at that. First of all, the long haulers. I tweeted this out this morning as well, and there were lots of responses. Look, long haulers, one possibility is, for example, I have a friend who's still admitted after 5 months in the ICU. He went in there, 46 years old, was diabetic, got COVID, kept listening to that bullshit message by somebody that you should just drink some hot water and you'll be okay. The end result was he had a severe case, called the ambulance, ended up in the emergency, and now 5 months is still there. Kidneys became really devastated, heart became devastated, lungs became destroyed. And now as he's recovering, he would probably need to have oxygen forever now. So much of the lung destruction and scarring and fibrosis has occurred. So that is the baby lung physiology that has happened. So that is one, that tissue damage, which may be permanent, has occurred, and that is a long hauler. Another possibility is tissue damage that may not be permanent, but would slowly recover. So that may be vascular damage, that may be the muscle damage, that may be lung damage, that may be upper respiratory system damage, that may be heart or other tissues. And it is possible it is recoverable damage, but it might take some time. So that is tissue damage. Then it is possible that macrophage activation syndrome has started and the immune system has become dysregulated. And that dysregulation is now becoming chronic or becoming long hauled. Then this is also possible that the virus is still present. Maybe the immune system and the virus, they are just working on each other in such a way that there is a persistent level of virus just sitting in there and it is just continuing. There may be other reasons that I do not know. So most of these things I'm speculating. I am sure about the tissue permanent damage. I'm sure about the tissue temporary damage that would become okay. I am not sure exactly how the immune system and virus are interacting in a long haul situation. But these are mechanisms, we've been talking about it, and they are exactly possible. I have seen so far that when I give my patients steroids pulse, they recover. All of my long hauler patients, even last week, and I tweeted about this in my tweets, I had a father and daughter, they both became sick. Father had cancer as well, and 62 years of age. He developed such a bad situation that his oxygen level went down to 84%. They took him to hospital. Hospital didn't have place. They came back, called me. We started managing at home. Fortunate for us that they both recovered. 2.5 months later, I was talking with them on a follow-up, and they both said, the daughter said that, hey, I still have fatigue and I sometimes develop fever. And father said that my gums hurt and I feel fatigued, and my gums hurt that I cannot chew well. So I started a steroid pulse for both of them. And now I talked with them this morning, and both of them, the daughter has become fully recovered. Her symptoms are gone. They were lingering for 2 months. And father said that I can start chewing on both sides now. So the pain has reduced. It is still there. So I'm going to give him one more pulse course for steroids. The point is, now, is that the virus still sitting in there? I don't think so. I think that they have a macrophage activating syndrome, or maybe chronic fatigue syndrome after the virus. Whatever that was, it responded well to steroids. So the point is, long haulers, it's a very, very good question. And I don't have any studies yet to look at those and say this is exactly what happens in long haulers. And I think there are going to be multiple categories, and we would have to find that out, and we'll have to save folks because they are continuing to be long haulers after months of the recovery.